a fatty meal can hit much harder than people expect. On Ozempic, Semaglutide, or Mounjaro, Tirzepatide, the issue is often not the amount of food alone. Fat already slows digestion by itself. Add a drug that also slows stomach emptying. Then the same dinner can suddenly feel heavy, delayed, and much more unpleasant for many people. Most people think the medication is acting up at random. Usually it is not random. The meal changed the load your stomach had to handle, and fat is the part that tends to stay longer. That is why one dinner feels normal, while another sits there for hours. Fatty food also hides in meals that do not look extreme. It may be fried food, but it may also be cheese, creamy coffee, nuts, rich sauces, or a salad drowned in dressing. The stomach does not judge whether the meal looked healthy, it responds to the total burden. I'm Dr. Kim, a licensed physician. This is not medical advice, consult your doctor. Here is the core mechanism. Ozempic and Mounjaro slow how fast food leaves your stomach and moves into the gut. That is one reason they reduce hunger and help control blood sugar. Fat does something similar from the food side, because fatty meals also leave the stomach more slowly. Put those together, and the slowdown gets stronger. Food stays in the stomach longer, pressure rises more easily. Fullness, nausea, burping, bloating, or reflux then become more likely. Reflux means stomach contents moving upward, which can cause burning in the chest or throat. That delayed timing is one reason people get confused. You may eat dinner at 7 and feel awful much later. Then you blame the wrong snack, the wrong dose, or even the wrong day. The meal was still the setup, but the symptoms showed up after enough time had passed for pressure and irritation to build. Because the timing feels confusing, people often reach for a simple rule. They assume greasy food is the problem and that healthy fat should be easier to tolerate. That sounds tidy, and it is often wrong. The stomach does not care whether the fat came from fries, avocado, salmon, or peanut butter. That is why a small rich meal can sometimes hit harder than a larger low-fat meal. Eggs cooked in butter may feel worse than plain toast and chicken. Full-fat yogurt with nut butter may feel worse than a simple sandwich. Healthy food is not always easy food on these drugs. Portion size still matters, but fat changes the pace. The problem is not just volume sitting in the stomach. The problem is how slowly that meal can move forward once both the drug and the meal are slowing the system. That is why people can feel stuck, overfull, or oddly sick after what looked like a reasonable plate. After a meal like that, many people make the wrong correction. They skip the next meal, get too hungry, and then eat fast or eat richer food later. That recreates the same setup. The medication did not suddenly betray them. The pattern simply repeated itself in a different form. There is another difference in symptom pattern that matters here. Some people mainly get nausea and early fullness. Others mainly get reflux, upper belly pressure, or sulfur burps. Sulfur burps are foul-smelling burps caused by gas building during slow digestion. Different symptom patterns can come from the same slowdown underneath. Looking across those patterns, one thing becomes clear. The drug is not acting at random. Many bad food reactions make sense once you look back at the meal. The meal was richer than usual, eaten faster than usual, or timed badly after a long gap. People call it random because the symptom arrived late, not because the meal trigger was truly unclear. Dose timing also changes your margin for error. Symptoms are often stronger when you recently increased the dose, restarted after a break, or are still early in treatment. That does not mean fatty meals become harmless later. It means your buffer may get wider with time, but it does not become unlimited. But getting used to the drug is not the same as becoming immune to food reactions. Some people do well for weeks, then get hit after one restaurant meal and think the drug suddenly turned against them. More often, that meal was richer than usual, larger than usual, or eaten faster than usual. One heavy dinner can still beat a stable routine. That is why the practical fix is simpler than people think. Lower the fat load before you slash the whole meal. Slow down before you assume the dose is wrong. A small lean meal is often easier to tolerate than a tiny rich meal. That practical pivot helps more than guessing which ingredient was evil. Eating fast can hide how rich a meal is. A burger and fries eaten quickly can feel bad, but so can nuts, cheese, and creamy coffee consumed almost absent-mindedly. The stomach responds to what arrived, not to whether the meal felt small. Fast eating also gives your body less time to warn you before you overshoot. The same trap shows up with liquid fat. Creamy drinks, blended coffees, shakes, and rich soups go down easily, so people assume they will sit easily too. Sometimes they do not. Easy to swallow is not the same as easy for the stomach to clear. Restaurant food creates another trap. The meal may not look greasy, but oils, butter, dressings, cheese, and sauces raise the fat load quickly. That is why people sometimes say they barely ate anything and felt terrible. They may be right about volume and wrong about how rich the meal really was. Because meals can fool you that easily, a practical test works better than guessing. Change one variable at a time, then watch what happens over meals. Try less fat, a smaller portion, a slower pace, or an earlier dinner. When people change everything at once, they learn little, and when they change one thing, patterns get easier to trust. Combinations matter too. Fat plus large volume is rough. Fat plus alcohol can be rough. Fat plus carbonation can worsen bloating and burping, and fat plus lying down soon after eating can worsen reflux. Many people search for one villain, but the problem is often a team effort. Also watch for patterns across meals, not just one bad night. 3 bad episodes after pizza, creamy pasta, or fried takeout is useful data. The goal is not to fear food. The goal is to identify your current threshold, because that threshold can shift with dose, timing, and meal pattern. But sometimes the pattern is no longer just about food tolerance. Severe vomiting, inability to keep fluids down, major belly pain, black stool, vomiting blood, or signs of dehydration need medical care. Dehydration means your body is losing more fluid than it can replace. That is not a home experiment. If those warning signs are not there, the better question is not whether fat is forbidden. Instead, ask a simpler question. How much fat can your stomach handle right now at this dose? How much fat can your stomach handle with your current meal pattern? That answer is often lower than people expect after dose increases. So if fatty meals hit harder on Ozempic or Mounjaro, the reason is stacked slowing, not bad luck. The drug slows stomach emptying. Fatty meals slow it further. Symptoms then build more easily and show up later than people expect. Eat lighter before you eat less, and respect the meals that already gave you an answer. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.